Welcome to the Family Office, planning for the people who matter most.
But here's my point, because I don't want to get onto that. If these people cared so much, then why aren't they figuring out how to fund mental health care? If they care so much. If Karen Bass cares so much, why is she not figuring out how to fund a mental health care program in LA County, which is probably one of the largest mental health issues is going on in LA County? Why isn't she doing that? And I'm not asking you like you know the answer, Len, but I'm asking because that's a great topic. Why are we not in this country funding that and funding mental health care? Because to me, mental health care is probably one of the biggest issues we face. And it goes against kids, adults, veterans, so much. But I know that was a lot there, Len, on you on that one. But
I don't even know where to go with it, man, because you talked about
just focus on the mental health, because Karen Bass just needs to be unvoted along with whoever. I don't know.
Okay. All right. So specifically with mental health, the issue right now is that there is legislation moving toward mental health and physical health being treated the same way. To me, I think it's a national issue because when you look at many of the mass shootings, there is a history of mental health. When you look at homelessness from state to state, there's a connection to mental health. And so I think it should be a federal issue because when you look at the outcomes that people have, mental health plays such an important role. And so now when you look at right now where you've got a shifting economy, we haven't yet talked about Kevin Warsh that is supposedly going to be the new Fed chair. When you look at Gen Z and you look at all of the disparities with regard to income, the cost for housing, there's stress and anxiety that's created by that. When you look at social media and the impact that social media has on how people are perceived based on what they look like and what they wear and their financial wherewithal and all of the pressures that happen around that's anxiety inducing. And so the legislation should be such that physical coverage and mental coverage should be one and the same. And unfortunately, here's the challenge with executing something like that. There aren't enough mental health professionals that actually cover their services with insurance because there's a disconnect there. And so insurance companies make it very difficult to get appointed with them for those practitioners that work in the mental health field to be able to offer their services to get covered through insurance. Because insurance knows they're in the profit making business, that if they start covering for mental health, now their profitability is going to go down significantly because it comes back to your point, Chris, that mental health is one of the big social challenges that we need to confront as a country. And if we don't continue down the path of confronting that, there are going to be more people that get killed by people who have mental health challenges. There are going to be more people who are homeless because their mental health wasn't taken care of. And because of the lack of understanding and the increased level of ignorance for people who suffer from mental health challenges, we're not going to collectively do something about it unless we're individually impacted by someone who has mental health challenges. So I think that unfortunately it's going to take more conversations by public media outlets and mainstream media outlets to make this a front and center issue, because people in Congress don't seem to have the will to make this an issue. But I think that's the wrong move.
I have an interesting perspective or an interesting way to ask you this. And I think, and I think it's why Congress isn't interested in it. If we can fund Planned Parenthood for abortions at a federal level, right? Why can't we fund mental health programs? And I know the answer why. And you tell me what your thoughts on this, because there's no ideal to rally around.
Yeah, I think.
Isn't that sad? Because you think about it, women's rights, my body, my choice, abortion, all the things that go along with the ideals behind warranting legal abortion. There's an ideal and an emotional ideal that you can fight against that, and it unifies against, or it stratifies everybody in there, or it gets a large group, amount of people in there, right? Whereas mental health, there's no really, what ideal can you champion or fight or rally behind, or where someone's going to go, you got to fight for your mental right to health. You know what I mean? Like there's nothing, and that's, I think, is the sad part.
I think there have been attempts, because when you look at a lot of the shootings, the mass shootings, have been people who have mental health challenges. So that could be an avenue. But then you look at people that are, connected to the NRA and all the lobbyists there, that becomes contentious. And so, now sometimes people make the connection between, okay, so what's the slippery slope? If you start legislating mental health, then now you're going to use that as a bridge to start legislating gun control. And we're not having that.
No, we can't have any gun control in this country, because if we lose the right to bear arms, it's dead. We're toast. The whole world's going to fall into communism.
I agree. I do think there needs to be more guardrails, though, on gun control.
Most definitely. And I think you need to renew your gun license or something every some odd years. Like, because like if you're a professional, you have to go through training every year or something. Like if you're a doctor, a lawyer, finance, anything, you have to renew. Business, even a business has to redo filings. So yeah, if I don't know how it is in that realm anyways, but you should have to go back and get checked again.
I agree.
I don't think they do that. I think it's one and done. At least in my experience, that's the way it is.
Yeah, overwhelmingly, that's what I understand. And so, I agree. Just like, if you have a driver's license, you have to, renew your driver's license. I think the same thing should be true if you want a gun.
So again, merit base, right? So if these folks really are, these politicians really are who they say they are, then they would find a way to make this work, because they find so many other ways to make things not work. Why can't they find and work, supposedly? Why can't they find a way? I think it was, what did I tell you, Len? We did the study. We had a couple chatbots do it. We had a few, like 3 chatbots do it. And they all came up with a similar conclusion. And that is that, we did it based on the fraud, the $20 billion or something that they lost for homeless stuff in California. With $20 billion a year, you could create a bare bones national healthcare program for all kids with $20 billion a year.
Sure.
It's that small amount of money. And I heard high-speed rail is going to cost $250 billion in California. So see, that to me, again, is the problem.
Misuse and misappropriation.
Right, exactly. So I think mental health needs to be a forefront in the country, because so many people struggle with that, especially young people today. COVID, like there's a whole group of kids that are and they openly talk about it. Oh, COVID screwed me up, or oh, COVID did this to me. And it goes across young children. It goes against middle-aged, young teen children, and then it even goes into adult children, right? And even young adults who are impacted by this. I mean, why are we not looking at that? Why are we not looking? Oh, again, because there's no
emotionally charged issue.
Yeah, exactly.
Yeah.
And I'm surprised, though, because we can't question, what the experts did, because that's why COVID's not questioned as much as it should be, because it would go against the opinions and the ideals, because there are people that champion those causes, right? That were for those causes of the lockdowns, and now are living with some screwed up kids. And they go, damn, that shit wasn't good. Yeah. Like, it wasn't a good idea. And they can't argue openly about that, because then they would go back and look like fools, because only politicians can lie and then come back 2 years later. So I didn't say that, even though there's a video of them saying they did it. So, I mean, that's just the reality behind, those types of things.
Well, Chris, it's always interesting having conversations with you, sir. And I never know where we're going to go in our conversations. And so it was good. I enjoyed this. And for those of you that are watching, find people that you can learn from, and that you don't have the same shared background, so you can continue to look at life through somebody else's lens. And that's what we look to do here on this channel. So if you like what we do, Feel free to subscribe and tell other people. And if you don't, it's okay as well. Comment, let us know what your thoughts are. So with that being said, Chris, it's always a pleasure. Until next week, man, you take care.
See you in the next one.
Conversation has given you clarity on your next steps. Please share this episode with someone who's walking the same path. Don't forget to like and subscribe so you won't miss future episodes. And remember, planning ahead isn't just prudent, it's an act of care. Thanks for joining us, and we'll see you next time on The Family Office.